Afternoon, everybody. I'm really excited to be your moderator this afternoon for the Marcus David Peters Act, how the provisions will impact you. I would encourage you to send questions through the chat function while we're going throughout, and if we have time at the end, we'll be able to get to that. We have two excellent speakers with us today. First, we have Alexandria Robinson. She's one of the two program coordinators dedicated to the Marcus Alert at the Department of Behavioral Health and Developmental Services. Her primary focuses at DBHDS include the Equity at Intercept Zero initiative, the Advanced Marcus Alert Training, and Marcus Alert Communications. She began her career at Arlington Community Services Board in 2014, assisting indigent customers with gaining access to necessary psychiatric medications. Next, she worked on the National HIV Behavioral Surveillance Program with Eastern Virginia Medical School. Alexandria began her state government career with DBHDS in 2019 as the Revive Program Coordinator, educating Virginians about naloxone and opioid use disorder. Niki Zimerman is originally from Miami, Florida, and she currently serves the residents of Fairfax County as the second vice president for the Fairfax County NAACP, as well as chairman of the branch's Economic Development Committee. She also serves as an appointed board member of the Fairfax County Economic Advisory Commission and is governor appointed to serve on the Virginia Board for People with Disabilities. Most recently, she's been appointed to serve as the Virginia State Conference NAACP Criminal Justice Committee Chair. Niki has a solid foundation and a passion for building strong and viable African American and minority communities that are underserved and overlooked. After the tragic events on September 11th, 2001, Niki felt a great sense of duty and enlisted in the U.S. Army, where she served for 11 years before transitioning into the U.S. Army National Guard, where she currently serves. In addition to her advocacy and military duties, she also hosts a weekly political and culture podcast centered around Virginia and federal politics, as well as Black hip-hop culture and advocacy called Unpolitical Politics with Cousin Niki on YouTube and Facebook at 𝐕𝐢𝐫𝐠𝐢𝐬𝐀𝐻𝐢𝐿. She's also the proud mother of a special needs teenager, Steven. And I'll go ahead and turn it over to you ladies to speak with us.
Hello, good afternoon. Thank you for having me today. Again, my name is Alexandria Robinson, and as Rebecca mentioned, I am one of the two program coordinators dedicated to the Marcus Alert with the Department of Behavioral Health and Developmental Services. The Marcus Alert is a part of the Marcus David Peters Act. Marcus David Peters was a young Black high school biology teacher, also a VCU honors alumni, who experienced a mental health crisis when he was involved in a car accident. He exited his vehicle. He was unclothed at the time, ran out onto Interstate 95, and Richmond police responded to the crises that he was experiencing, and unfortunately, he was fatally shot and killed that day, and that was on May 14th, 2018. Through legislative action from his family advocating, we have the Marcus David Peters Act, which Governor Northam approved in the fall of 2020. Unfortunately, stories like this are not unheard of and can be common interactions when people who are experiencing mental health or any type of behavioral health crisis or people with developmental disabilities are interacting with law enforcement, who have become the de facto response to these crises. So the Marcus Alert does require the Department of Behavioral Health and Developmental Services to interact with the Department of Criminal Justice Services, and we are working collaboratively on several of the initiatives that are laid out within the piece of legislation. And so I'll just give a brief update of exactly what's required at the state level, at the local level, and so far where we are in that process. So at At the state level, in January of 2021, we convened a statewide stakeholder work group. And this was made up of 45 individuals who came from several different backgrounds. We had law enforcement, we had racial justice, social justice advocates, mental health providers and advocates. We had substance use, we had developmental disabilities advocates included in the group, as well as others that I might not be detailing out right now. But from those 45 individuals, we broke into 6 work streams. So we had one work group that focused on the triage part of the Marcus Alert. It looks at connecting the 911 calls that people might have or might place for behavioral health crisis, looking at how we can make sure that those calls are being diverted to the appropriate resources. We had a group looking at equity to make sure that we were putting an equity lens on all pieces of legislation or any policies that we put out of our office. Looking at co-responder models, they focused on frameworks and models for the development of co-response teams, community input, which gathered input from impacted communities at the state level that helped inform the plan and developed guidance for local community input. We had a local roadmap work stream also that focused on creating resources and a process for local governments to plan and submit their plans for their Marcus Alert implementation. And then we had a work stream that also focused on data and reporting. So from those 6 work streams, we were able to suss out 3 main points. And one is that this was going to be a large system shift. We're switching from what has primarily been a law enforcement response when someone is in crisis to really making it an appropriate behavioral health response to a behavioral health crisis. Also, we're shifting the role of law enforcement. We're shifting that role to be, or the role of law enforcement to be behaviorally health trained professionals who have the skills necessary to triage people who are in behavioral health crisis. And then law enforcement would have a supportive role to community-based behavioral health crisis response when there are safety concerns present, but law enforcement would not be required to be that first response that they have been for so long. We also identified that building a robust system of community-based crisis services with equity is a key to this design. So the state level components that are required are a statewide cross-sector triage framework. And so we were able to develop a four-level framework that is able to categorize the level of urgency or acuity of the call. So it's a level 1 through 4, with level 1 being the lowest level of call, where a person who is in crisis and makes a phone call, they're able to really just talk with someone and be able to talk with someone over the phone and work through their crisis that they're experiencing, up until level 4, which is in a situation where someone is a danger to themselves or to someone else and they have the means to act upon it at that time. And so the other state level components are the minimum standards for diverting calls to 988, and for mobile crisis teams. So 988 is a new number. It's a new 3-code behavioral health crisis number that will be implemented in July of 2022. So it is a federal 988 number. So it's similar to 911, where you call if you're having an emergency. 988 is specifically for behavioral health crisis. So part of the Marcus Alert implementation is utilizing that new 988 phone line that is going to be available in July of 2022 and really integrating it into our current 911 system, so that if someone is calling 911 because they're having an emergency, they can still get connected to those behavioral health lines. They don't have to directly call 988. We're really looking at this as a no wrong number approach. Other state level components that were required were specialty models that are including protocols or processes for teams that can be developed for mobile crisis teams. We also came up with an Equity at Intercept Zero initiative. So when we talk about Intercept Zero, it's a reference to the sequential intercept model, which looks at the places where people who are in behavioral health crisis are intersecting with the criminal justice system. And so when we talk about Intercept Zero, it's the ultimate intercept, as in there is no intercept with criminal justice. Intercept Zero represents your community services. So before there's ever a point of interaction with law enforcement or any of the criminal justice system, if we have adequate services at the community level, people don't have to interact with them. So building up those systems there, and also increasing the training requirements that we have when it comes to behavioral health crisis for across disciplines. So we're developing an interdisciplinary training for law enforcement, also for behavioral health providers. There's trainings that are developed for mobile crisis teams as well that are outside of those mobile crisis trainings are outside of the Marcus Alert training, but they coincide with the same time frame. So when it comes to the Marcus Alert implementation, the law requires us to implement Marcus Alert in one locality within each of the DBHDS regions. So DBHDS does have 5 regions across the state. And so those localities have been chosen. In Region 1, that's going to be Orange, Madison, Culpeper, Fauquier, and Rappahannock counties. And Region 2, it's Prince William County. Region 3, we have the city of Bristol and Washington County. And that's going to include the towns of Abington, Damascus, and Glade Spring. In Region 4, city of Richmond, and then within Region 5, the city of Virginia Beach. So those are the initial areas that will be implementing the Marcus Alert. We had a state plan that was due on July 1st to outline exactly what the current landscape of Virginia looks like when it comes to crisis services, as well as what are some of the developments that DBHDS will be making as part of our state plan. And so we did submit that plan on July 1st to the General Assembly. You'll be able to find that plan on our website, which I believe is linked or will be linked in the chat throughout this call. The full plan is very long. It's 172 pages. We also have a summary of that plan, which I think is 30 some pages. And those are both available on our website where you can read more in detail about what Marcus Alert from the state level looks like. But ultimately, the Marcus Alert plan is a local initiative. DBHDS does oversee Marcus Alert, but we do not create the local plans. So each locality has been tasked with the Marcus Alert to establish 3 protocols. So this is kind of the nitty-gritty of exactly what it is. So the first protocol is that now we want to have an ability for people who call 911 and are experiencing a behavioral health emergency to be able to get linked to those 988 resources that I mentioned before. So again, it's the no wrong number approach where someone can call 911 and they still are not going to have to necessarily interact with law enforcement. They'll be able to get a different response. There's the second protocol, which is requiring the mobile crisis hubs that are located across the state of Virginia, and those are regionally based as well. It's requiring them to have agreements with local law enforcement so that if someone, those mobile crisis hubs, they respond to behavioral health crisis. If you are responding to, or if they are responding to a mobile crisis and it happens to need law enforcement backup, they do need to have those contracts in place where local law enforcement is able to provide that backup to them. The third protocol that they require, or that the Act requires, is that law enforcement develops a special response for behavioral health crises. So that's part of the plan that is also developed locally, and that's developed within those local law enforcement agencies, and they're working in collaboration with their local behavioral health agencies as well as other stakeholders to develop those plans as well. There's also a voluntary database that's required at the local level. So it is voluntary for individuals to sign up and be a part of that database. And what it looks like is going to vary from locality to locality. However, the voluntary database essentially is a database held at the local level that contains the names of people who register voluntarily to give their status of saying this person has a developmental disability or a mental health illness, or this person has a substance use disorder. They're able to provide that information so it can help inform the response if there is a call to that address within that database. Also, another mandate from the Marcus Alert legislation is for community coverage with mobile crisis teams. And community coverage is going to look very different across the state as well, because this again is a piece of legislation that puts the power into the local communities to adapt resources the way that they need them adapted. So mobile crisis teams, however, will be able to respond to behavioral health crises that individuals are experiencing when they do call for emergency help, whether it's 911 or 988. And so those are the requirements of the Marcus Alert at the local level, as well as what we have worked on and developed at the state level too. And that's just a high level overview. There's a lot of information and a lot of components within the legislation and how it's rolling out across the state. And so I will be happy to answer any questions, I guess, during our Q&A session, but I'll go ahead and pass the mic back to Rebecca.
Sorry, I am back. All right, well, I'm happy to pass along to Niki. Are you ready?
I am.
Great. Niki, how do you see both the racial justice and how it intersects with disability justice, especially relating to your work with the Marcus David Peters Act?
So the Fairfax NAACP, we do not specifically work with the Marcus David Peters Act. We will help implement it. We will help enforce it. We will ensure, to the best of our ability, that our law enforcement follows those policies to the T, and we will work diligently so that they can do so. Now, as it concerns the racial portion of it, I think we all understand that Black males and Black people in general are more profiled to anyone else. And we also understand that other races are more so given the benefit of the doubt when it comes to mental health crises, when it comes to mental health breakdowns, when it comes to developmental disabilities. We have seen this on the news. We've seen it on social media. We've seen it throughout I would say the last maybe 10 years, we've seen the disparities and how each are treated. So when it comes to mental health, we saw here last year in Fairfax County, right after, on the heels of the George Floyd protests, there was a Black gentleman. He was having a mental health breakdown, and the mobile crisis team was there. They were talking him down, and a police officer came and tased him repeatedly. And that was on the news. So what we have to establish and what we have to enforce with our police departments is we bleed just like you. We have mental health issues just like you. We have developmental issues just like you. And we have to ensure that they are getting the adequate training that they claim to get. Oftentimes, you'll speak to the police chief and you say, well, what do you have in place to differentiate between someone who was high, someone who is violent, or someone who's having a mental health breakdown, or someone who has a developmental disability, and they just don't understand what you're doing. And what you will hear them saying overwhelmingly is, oh, we go to training, we have officers that go to training, we ensure all of our officers go to training. But then, like I said, as we saw last year, they tased him when he was already being talked down. So we have to ensure, and we really have to make an effort, and that is what we do in the Fairfax NAACP, is that we have the police chiefs walk us through their training, and we call them out and we say, wait, this is death by PowerPoint. So what are you really showing them? How are you teaching them restraint holds? And I think, as we saw with the tragic death of Marcus Peters, he was a naked man who was very thin, maybe 5'9". He could have easily, in my opinion, as someone who served in the military and someone who knows, some of the training that law enforcement does, they are trained in combatives. They are trained in hand-to-hand combat. They are trained to take someone down. I'm sure that they could have taken down a naked man. They could have held him down, but yet the first reaction was to shoot. So in Fairfax NAACP, we have 3 separate committees that work together in unison for certain complaints. So we have the Legal Redress Committee, and you can submit a complaint through Legal Redress. And if it is something that they can handle, or something that they can do, they will take that case. Now, if it intersects with our health committee, as we're talking about mental health, they will bring in our health committee chairs, and they will discuss and find resources and find solutions. Then we have our criminal justice chair, who, if it's something that is dealing with discrimination, if it's something that's dealing with brutality, if it's something that's dealing with any of those things that we all know happens, they will all work together in unison to find a resolution, whether it is to confront the police department, whether it is to make a statement, a press release. But we do we do the things that are within the confines of our branch to help. And let me tell you, we have made strides in the methods that we use with our president 𝐋𝐚𝐰, but we have made strides with that. So I hope I answered your question.
I think you did. And I think, you mentioned the strides. How do you envision the Marcus David Peters Act working toward a more equitable state?
It gives accountability. It holds police accountable for their actions. See, when you have a mental disorder, or you're having a mental breakdown, it can happen to any of us. Any of us can be so stressed to the point where we either self-medicate and it doesn't work with our bodies, and then something happens. This will hold police accountable for their actions on their end. Okay, the Marcus David Peters alert does just that. It gives so many guidelines that they are able to avoid fatal contact, fatal injury. It allows them to have the mobile crisis team, which a lot of the police departments have right now. But if you ask me if they are adequate, no, I don't think so, because they still don't have the proper training. So I think the Marcus David Peters Act, number one, gives accountability for the police and how they handle things. And from a budgetary standpoint, they are going to have to invest into more mental health counselors, more mental health resources for these people. And they are not going to be able to be as trigger happy as some of us like to say. They're not going to be able to be, so quick to do these things. They are going to have to stop and assess what is going on with this individual, and really assess if that person is a threat to them, which in my opinion, Marcus Peters was not a threat, as a man that had 0 clothes on and who was small in frame. But that's but back to your question, it gives accountability. And I love the way it was written because it gives so many resources that it almost seems foolproof that
Thank you.
that anything would happen
Sure.
moving forward.
Thank you very much for that answer. How does the Act incorporate and prioritize the experiences of Black people, Indigenous peoples, and other people of color in Virginia?
Okay, say that one more time.
Sure. How does the Act incorporate and prioritize the experiences of Black people, Indigenous peoples, and people of other people of color in Virginia?
We have seen overwhelmingly that the police interactions with that group of people is almost always, for the most part, by and large, negative in the end. If it had not been for cameras and smartphones, we would not know half of the things that go on. This would directly affect Blacks, minorities, Indigenous people, because whereas in the past, they could easily say, my life was in danger, or that person was high. Now they're not able to use those excuses, which, you know, at times I call them excuses. Sometimes, yes, a person with a mental health lapse, I would say, sometimes they are a danger, but they can always be talked down. They can always be restrained. But this closely intersects with that population of people because those are the ones that by and large are affected by the treatment of the police officers, by treatment of law enforcement. So again, this gives them this forces accountability on their part, that they would think twice when they see someone having a crisis. They will not be so quick to pull something out to cause harm. They will have to think on their feet. They will have to assess the situation, which police officers are absolutely trained to do. So this culture of, I'm just gonna pull my weapon out on you, is astonishing to me. But again, with these policies in place now, the key word is accountability. They are forced to have accountability for their actions. And again, I thank the lawmakers and the grassroots organizations and Mr. Peterson's family that advocated for these changes, who understood Blacks are overwhelmingly affected by police misconduct. We also have, you know, our population, we do have people with schizophrenia in our families. We do have people with autism. My son has autism. My son wears earphones a lot. So he may not, sometimes he doesn't know what's going on around him. So these put things in place so that my son and other little Black boys like him can maneuver this world, maneuver this commonwealth without the parents' fear or without any fear of bodily harm by law enforcement when they interact with them. So this really does help Indigenous, Black, Hispanic, and other minority groups to have some sense of relief when they are navigating the world. We've had, I believe, it was here in Virginia, I'm not sure if it was Fairfax, but there was a gentleman with autism at the library. People in the neighborhood knew him. He wore headphones. The police thought he was suspicious and they just pounced on him. Now you can't do that. So again, accountability is the word for the day with the Marcus Peter Act as far as law enforcement. But as I've said before, we have to ensure, because they're not going to do it on their own. We have to ensure that they follow those guidelines and they get the resources that they need to have an effectively implement those policies. and not just have anybody on the streets patrolling and not understanding what schizophrenia looks like, not understanding what dementia who has a mental break. They need people on the ground. They need boots on the ground, mental health professionals who can be the mediator between them and the person, because if not, there will be plenty of other, and I hate to say plenty of other Marcus Peters in Virginia. So we have to hold them accountable, and we have to ensure that they implement these policies effectively.
Thank you. Alexandria, I'd actually like to give you an opportunity as well to answer that question, since you're doing the work from the inside. How has the Department of Behavioral Health incorporated and prioritized the experiences of people of color?
Yes, so those perspectives, that lived experience was at the core of, and still is at the core of, the work that we do. So from the initial forming of our statewide stakeholder group, we were sure to include people of color and prioritize including people of color, as well as social justice, racial justice advocates, to our statewide stakeholder group, which informed our decision-making and policies as well. In addition to that, I mentioned briefly that we developed an Equity at Intercept Zero initiative. And this is actually one of my favorite parts, not just because I work on this initiative or oversee it, but we have recently created a request for applications, and the application end date was on September 20th. So we're in the process of reviewing applications for this grant opportunity right now. However, we were looking to fund 5 innovative projects to really look at crisis services at the community level that were not associated with your local government systems, which the local community services boards are. And a lot of people, there can be a lot of mistrust with the local government systems. And so understanding that there's a lot of history there, specifically when we talk about race as well. So we are looking to fund some innovative projects of some community care teams, mobile crisis teams, research projects. We are looking for people to submit projects that are working with HBCUs and creating a development pipeline to getting into the behavioral health profession, looking to support more Black students to pursue those journeys. And if they already are pursuing those journeys in college, helping them kind of pipeline into getting licensed and becoming providers, as well as we were requesting applications for a Black-led statewide crisis coalition. That coalition will oversee the crisis transformations that are taking place in Virginia, not just through the Marcus Alert implementation, but also STEP Virginia, which is a big transformation process that is taking place across the state. Many changes are coming under STEP Virginia, and crisis is just one of those. And so they'll be looking, it's a Black-led coalition that will be looking at equity. They'll be informing policies that are created, looking to evaluate those programs that are put in place, and working with those other projects under the initiative as well. So that's just one example of our understanding that we need to have all of our decisions informed with a racial equity lens, and we have been sure to include people of color, particularly Black Virginians, in this process at every step of development.
Thank you. We have a question from one of the individuals participating today, and it goes, I think, very much back to what Niki was talking about the accountability factor. Are there any actions that are specifically being taken to address the actual culture within these police departments? And I'm
So-
happy to hear from both of you on that. So,
Okay, so I can speak, I guess, from a state standpoint. And so unfortunately, within our department, we do not have purview, or we do not oversee local law enforcement. So this is a joint piece of legislation. There are requirements for the Department of Criminal Justice Services also. And a lot of those requirements actually are making sure they are collecting appropriate data. So there are 17 kind of requests that the Marcus Alert has for the Department of Criminal Justice Services, which I did not detail because I do not work on that part of the project, but you can find those details within the Marcus David Peters Act, which is available to view online. And it's about it's about more accountability and just about having more visibility of the numbers to look at practices and just to be more involved in what's happening at the local level versus what we've done traditionally.
okay, great. Thank you. Nikki, did you want to speak a little bit on the cultures within the police departments and how this might help?
Can you ask the question again for me?
Sure. What actions are being taken to address the cultures within police departments?
So here locally, here in Fairfax, we actually, the police can't, the police don't like us because we stay over there with, confronting the chief, confronting the board of supervisors about the chief, about the police culture. We actually work with a lot of the communities here. We have historic Gum Springs that we work with whenever they have a community forum, and helping them to implement or discuss at the very least some of the issues that they have. So what we do on the local level here in Fairfax County NAACP, we really do go down to those police departments. We take statements, we take complaints, we hold them accountable. We won't let them give us a political answer, or a side answer. We get them to the point where they start stuttering, and that is when we know that they're not doing what they're supposed to do. So we actually do work diligently through our President Karen Camlin and past presidents, and again with the leadership within Fairfax NAACP, we ensure that we are active, working sometimes with the police department, and sometimes we work against them because we're not playing ball the way that they want to play. Sometimes the police departments like to say, well, we don't have a race issue here. We're so diverse here. But then the numbers say different. And then they look at you crazy when you give them the actual numbers of what it looks like and what they're doing. So we have made a lot of changes dealing with even the RSOs in the schools here in Fairfax County. We have a civilian review board here that we work with and we monitor, and we ensure that they're doing the right thing and that they are empowered with the resources that they need, that they have everything that they need to be able to have a fresh set of eyes to do what it is that they need to do. So we are doing the best we can as far as changing the police culture here. We've also had meetings where we addressed the fact that they are not recruiting Black officers. Right. So one issue is that we brought to the table, and they have attempted to fix it, is the mistrust of the Black community and the police department. And that is something that they need to work on. There's a reason why Blacks are afraid of police. So we have actually dealt with that issue here locally. We have also dealt with, again, the recruiting. If the county is very diverse, however, the police force is not. They are not recruiting at Bowie State. They are not recruiting at Howard. They are not recruiting at VSU. However, they would drive 4 or 5 hours to New York and try to recruit. They will go to Penn State and try to recruit. So these are the things that we have been working, again, either with or against them, to ensure that the police culture is changed. So with the hiring of a more diverse police force, going to community meetings, again, holding them accountable, showing them the facts, showing them the numbers, and also working with and sometimes against the Board of Supervisors, because our agenda and their mission may not intersect. So what I've used this word so much today, but it's the word for today, is accountability, to break down that culture that they have here. And we've seen it last year. And we're holding them to all the promises that they made during those protests. Everything that they said during the protests that they wanted to do, we're holding them to it here in Fairfax County. So thank you for that question.
Well, thank you, Nikki and Alexandria, both. I appreciate your time today and speaking with us. It is absolutely clear that you are both very passionate advocates, and your work is very serious, and we appreciate all of your hard work on it. I hope that everybody here has a great rest of the day.
Thank you for having us.
Thank you so much for having me.